Practice, Advanced Degree, Stephanie Skogen. Stephanie is such an insightful individual who shares her assessment and recommendations with the rest of the care team. This increases the depth of understanding of a patient and family needs and allows the team to provide a more effective and uniform approach to meeting the patient's needs, addressing their anxieties and fears. Her attributes contribute to the team dynamics, making our work environment a healthy place to share ideas with each other to contribute to patient care. These characteristics seem intuitive to Stephanie, although common sense tells me she has to have worked to develop these skills, which now appear so effortless. Stephanie's assessment skills lead to timely relief of physical symptoms, which is then directed to relief of emotional symptoms. She is remarkable for her ability to find the right dose of empathy, humor, reassurance, all contributing to a sense of peace and trust. As patients struggle to make the right decisions in the midst of an imminent, untimely death, Steph walks this path with them as a guide, always helping families stay focused on life validation, finding the ways to provide reminders of all the ways this life has had meaning. Stephanie's bright personality is one that lights up a room the minute she enters. She has a unique ability to help patients and families feel less vulnerable and afraid in their often uncontrollable situations through her good communication and symptom management skills. She is an inpatient palliative care nurse practitioner, and her focus is on healing. She works tirelessly to make sure that the environment for the patient and family is one where healing can occur. She encourages the use of essential oils for patients and works with staff to create the best environment for the patient, such as encouraging the use of a double bed so a patient's wife can still sleep next to him while he is dying. Stephanie has developed trusting relationships with her hospital-wide coworkers. She is viewed as approachable and non-judgmental. This is a very valuable trait that promotes a sense of peace, trust, and teamwork in the often chaotic and unpredictable environment where life changes and death is present on a day-to-day basis. She is an anchor in the storm for so many people. Steph is a wonderful listener and knows how to let the silence sit and allow patients and family members to share their concerns, their fears, their story. She takes her advanced listening skills to also hear the things unsaid and addresses emotional issues that may be holding the patient and family back from the best care. She is incredibly empathetic and caring, spending all the time needed with the patient and their families to listen, teach, explain, re-explain, and reassure in an understanding and non-intimidating manner.
So one of the things that stands out to me when I think about my nursing career is my grandmother was 54. She had metastatic breast cancer. She was actively dying. I was 14. And one of the nurses was kind enough to spend a little time with us kids and told us that it was okay to talk to Grandma, that she could hear us, and that it was okay to hug her. So those things have always stuck in my mind when working with patients and families when there's a dying patient. So Grandma was a nurse, and she had always said, even when she was battling cancer, "Oh honey, you'd make such a good nurse," and have me run and get things for her. And I think that stuck with me. And at that time then, when of her death, I thought, I'm going to go and be a nurse for Grandma. And that is what led me to this career, and I think motivated me to move into the field of palliative care. And I think that there's a lot of lessons that we learn along the way, working with patients and families, basically to put them at ease and let them know there's no right or wrong, and that this is a process and that it's something we're all going to have to go through, but that if we can make it a little easier for them, that's our job as a nurse. And I think more than anything, in receiving this award, I'm very proud. Proud to say that I'm a nurse and part of a profession that you can cry with patients and families, and you can hug, and you can buy them birthday cakes and celebrate happiness even though death may be near. And I think that I work with a lot of awesome nurses at Gunderson, not just on medical oncology, but in the ICU and on 6 West, and that all of these nurses make me really proud to be in this profession and to work towards giving the best care that we can give. So I'm very grateful to my family, especially my girls, Sydney and Kennedy. They inspire me to be the best person I can be and the best nurse I can be. And to my work family, the nurses that I work with, the PAs, the doctors, the health unit coordinators, everyone that's so helpful and makes my job worth coming to work every day. If there's anything that I want to pass on to the other nurses here, it would be proud. Be proud of who you are and what you do every day.